So Barry, what are the things that I need to do in the remaining 2 to 3 minutes to help me to reach the diagnosis?
So examination. So there are things you need to always do in all dizzy patients. So simple things like an ECG, postural blood pressure. Examination-wise, you don't need to be an expert because it's impossible to become an expert without continuous exposure to these sorts of patients over a long time. So there are two things that would definitely advise you to do. Mm-hmm. Always check the gait. The patient can't walk properly. The tandem walk is impaired. It implies central lesion. And always do a Hallpike. That's because you need to look for BPPV, which is the commonest cause of acute vertigo. In a later section, we will show you how to diagnose and treat BPPV in your practice. By taking this approach, you will both be able to manage the majority of cases in your practice, but also you'll rebalance your referral pattern so that you'll be sending more acute patients, which are actually the minority, to the specialist services. And I think overall that will lead to better management of patients and reduce anxiety levels for GPs.
And presumably also improve prognosis, as mismanagement might lead to chronic dizziness.
You're absolutely right. So I would say we have a section later on about chronic dizziness and its treatment and rehabilitation. But one of the commonest causes of chronic dizziness is a failure to diagnose the underlying cause, which therefore leads to a failure to treatment. We will have a section on myths later on, but just to reiterate that the idea that dizziness is difficult to diagnose at some point in the chain, be it in the hospital or general practice, and that there's poor treatment, that's incorrect. There's virtually always a diagnosis underlying a patient's dizziness, and there are effective treatments for these patients. And in the right place and right hands, the majority of dizzy patients do get better. And again, we'll have a section later on managing and treating chronic dizziness.